Welcome to another special episode of Cancer Buzz. ACCC is providing a variety of resources to help cancer professionals navigate oncology care during the COVID-19 pandemic, including this mini podcast series. On this episode, making telemedicine work for both patients and providers. Joni Candler is the ambulatory nurse manager of the Multidisciplinary Clinic, which is part of the Indiana University Simon Cancer Center.
We actually weren't doing any virtual visits prior to the pandemic. So this is something that was completely new to us. And I really have to commend my directors who played an active role in making sure that we were keeping the patients at the forefront as we made decisions on how we were going to move forward with virtual visits.
What's your experience been like to date with what the technology that you chose? Were the providers and the patients adapting to this, new way of visiting patients?
Yeah, so we actually elected to utilize Doxy.me. We have a very large organization, so we have multiple platforms that our organization uses. However, the HEMONC division decided to go ahead and move forward with an HIPAA-compliant format, which was Doxy.me. And that was really just to make sure that we were not overwhelming all of the platforms that we were using and making sure that they were working whenever we needed them to work and not crashing. We had to make sure that we were keeping it simple for the patients to make sure that they were in the right waiting room, that they understood what link to use, and helping them guide patients through that. So we actually made a decision as the division to have our medical assistants continue to call our patients 30 minutes prior, just like they were here, and we'd be putting them in a room. And we did that to ensure that we were still doing our cancer distress screenings, just to make sure that regardless of whether they were here or they were at home, it gave us an opportunity to assist patients getting into the virtual waiting room correctly and making sure that they were still feeling safe at home, that they didn't have additional resources that they needed, that the distress wasn't higher because they weren't coming into the office to see their physicians. And so that actually helped us feel more comfortable doing virtual visits when it was something that was completely foreign to us.
Do you have any recommendations for listeners about any standardized setup to, like you said, help patients understand, keep it simple for them? Did you have any email handouts or did you have any tip sheets for them that you could walk us through?
We really utilized our patient portal. And so we reached out to patients who did not have access to the portal and make sure that they felt comfortable, getting access to that kind of early on before we started scheduling virtual visits. That kept things compliant within email so that we were emailing through their portal, and it kept, our team members and personal information safe as well. And so being able to do that with the team member portal, we were able to give them a link that they could click on, directly into their portal. Also, if they just weren't sure or they didn't check the portal, we used that MA phone call to touch base with them, make sure that they felt comfortable, with the day's visit and everything that was going to be coming in the next 30 minutes. We also sat with them and actually asked them, okay, have you pulled up the website? Go ahead and enter your name here, and walked them through stepping into the actual waiting room on the virtual app, just to make sure that they were going to be there when we alerted the physician the patient was ready as well.
What about the providers? How do they feel about seeing their patients online?
That is like all over the place across the board. Some of the providers have really embraced it and be able to use the technology to share the screen and show the patients their CT scans and utilize those platforms to be able to do that. Some of our providers were really excited about it in the beginning. It's like, this is going to be great. And then they're like, I miss actually seeing patients face to face. So it's kind of been mixed feelings. I think all of us are ready to develop what the future looks like now that we've gone through this, and how do we continue to use virtual visits in the future as well.
What does that forward planning look like for your program then?
So we don't have the answer yet. Indiana is just opening back up and kind of lifting those shelter restrictions. Marion County, which is where our hospital is located, has kind of stayed under shelter a little longer than some of the other counties in the state. So we're just to that point where we're even, lifting some of those restrictions. I think for cancer care. I'm excited to see how the new normal looks, is what the phrase we use every day, I think probably 100 times a day. I do hope that we continue as we make those decisions, make sure that our patients are at the forefront of those decisions. And we've done a really good job of making sure that we're continuing to keep them there. I would like to see us start monitoring those visits. Like, is it every other visit? Is it every, third or fourth visit that we're doing a virtual visit to minimize exposure? I think that keeping appointments for virtual visits towards the end of the day has helped our patient flow now that we've started to see more patients. So in the mornings, patients who are scheduled with scans and have infusions still, those are taking up those morning slots. And we're moving the virtual visits towards the end of the day to try to just help the MAs with their process and infusion center with their flow as well.
Thank you for joining us. Check out the show notes for more resources on the telemedicine topics that we discussed. As we compile resources for the cancer care team during the pandemic, what we see over and over again is that cancer care providers continue to be resourceful, adaptive, and dedicated to meeting the needs of their patients. Next time on Cancer Buzz, we briefly step away from the topic of COVID-19 to look at the relationship between immunotherapy and mental health. Until then, for the Cancer Buzz team, I'm Summer Johnson. Stay well.